I'm one of the assessors of the Stop Smoking Practitioners program that we're looking at this evening, and how to get through that. So my job is, when you submit assignments, I'm one of the assessors who make sure that you've met the standards and feeds back results to you all.
And I guess too, another part of our role is, if you get stuck with anything along the way, or you need any assistance in completing any part of the assessment, or something's not clear, then you've got access to us so that you can ask us any questions so that we can help you along with the assessment tasks. So I'm just going to share my screen to bring up. Nice. There we go. So this is what we'll be covering today: the student overview. And what you're actually doing. So you're pharmacists, you're doing the health professional ones. We're going to touch on priority populations, which are Māori, Pacific, and pregnant. Then we're going to go across the 3 assessment tasks. So the assessment tasks that you will need to complete, which will cover the stop smoking medicine, working with Māori Pacific clients, complex needs. I'm going to take you through our website so that you can have a look at what you've got available to you. There is a chat function that's part of the Zoom facility. So if you have any questions, maybe you want to ask a question while we're going through, jump on that chat and then just put your question, and then we can come to it. Okay.
Can I speak? If I speak now, can you hear me?
Yes, we can.
Okay, no, that's fine. Thank you.
So just in terms of a student overview, this is the numbers of people that we've got going through the program at the moment. So there's you can see there how many graduates we've got, how many are on the full program, fast track, and the numbers for the health professionals, which is the ones that you found that the pharmacists are on or will be completing. So in terms of the tasks that you'll be doing, there are only 3: stop smoking medicines, and then the other 2 are the case studies. So Grant will talk you through the case study. I'll talk you through the stop smoking medicines. And part of that is that you will have had to have attended a 1-day health professional stop smoking training workshop, which you may or may not have already attended. So Denise runs those, and NTS, National Training Service, we ran one in November and one in December of last year. So I was going to touch on priority populations in terms of who are the biggest or the largest smokers in our population, the population of New Zealand. So these are the 3 priority areas that we should probably be looking at in terms of, so if you get people coming in of Māori, Pacific descent, or maybe pregnant, then they probably where we should be spending some time. So we've had some questions coming in around, I'm not Maori, so how do I then serve Maori? I feel a bit nervous about working with Maori. How should I act? So probably we just sort of look at the approach to Maori. Is it any different? Well, actually, it's probably we would treat everybody the same that came into our pharmacy. So some people do feel nervous about engaging someone that's not the same as them. But I guess if you just sort of, in my experience, if we work openly with them, and if you get stuck with something, just let them know more than anything, because I think that's probably where people get let down, because they get all nervous and they think that they should be doing something or shouldn't be doing something. And yet, in my experience, if you just say to someone, look, I haven't really worked with Maori a lot before, you might have to help me through this, and we can work on this together. And then they'll be able to sort of talk through the concerns that they might have. So just interesting to sort of look at those points. So, don't feel that you're stereotyping Maori or that you're insulting or offending someone if you don't know. It's okay not to know. There's lots of things that I don't know about different people with different cultures. So I'm more than happy to just ask the question and let them know that I'm not too familiar with it. Or if, they could guide me or help me, chances are they will do. Interesting to know that sort of in a lot of situations, Maori and Pacific people are not offered services if our professionals think that maybe they won't understand or they won't follow through. Well, I guess just in terms of working with people, we are all people, as you very well know. So just ensuring that when we're working with our high priority populations, that we just do it the same as we'd like to be treated. I guess in terms of some information around discrimination in health. So if we have a look at that, there's a difference in life expectancy between Maori and Pākehā, so the extra sort of 8-year difference, which is kind of quite high really. And as in terms of sort of looking at Maori, they have similar or higher risks of getting diseases and a higher chances of them dying from that. So we're sort of finding more and more the disparity between Maori and non-Maori, the gap is growing. So smoking has a lot to do with that in terms of the numbers of Maori that smoke. So, you know, they've got the highest smoking rates. It sits around 33-34%. Pacific, their prevalence is around 25% of the population smoke. And then mainstream, we've got around 15%. So there's quite a big gap between the Maori, Pacific and non-Maori in terms of smoking prevalence. If we just sort of take a more slightly in-depth look at Māori health, if we were having a look at, you know, these numbers down here, the Māori are probably 9% more likely to develop cancer, but 77% likely to die from that cancer than non-Māori, which is quite high. And their health disease for Māori is sort of twice that of non-Māori. Well, admissions to hospital are only 40% higher. So I guess in terms of the work that we need to do with Māori, it's probably a little bit more than we would do with our non-Māori or Pacific people that we would be seeing. We'll send this information out to you afterwards so that you'll be then, if you want to find any more information in and around that, we can have a look at that. So you'll get access to this presentation when we're finished. I'll put that up and then I'll send it through to Denise and she'll be able to show you where the link is for that. If we have a look at the mortality rates from lung cancer, Māori, they're very high, and that's due to a few factors: late presentation, delays in treatment, low surgical rates for early stage disease. Well, that's probably interesting in and around there that Māori are nearly twice as likely to die from cancer, even though they're only 18% more likely to have cancer. Okay, so that's probably some of the reasons why Māori have an unequal impact on cancer. More likely to have delays in receiving treatment, and 4 times, that's interesting, 4 times less likely than Europeans to receive curative treatment. This is probably a question that probably, well, people often say, well, what can I do? How can I help? What's, so here's just a few things that you could possibly be doing to increase the reach. So when we're working with Maori or people we don't really understand a lot, just spending that little bit more time investing in relationships and building that trust. I guess with behaviour change medicine and smoking that we do, a lot of that building rapport and getting to know people just that little bit better is a lot really helpful when it comes to the way we engage with people. Actually, we're engaging people with their health issues, and every time we see them, it's an opportunity to educate and engage them. Okay, so something else that's probably really useful is actually when we're working with our patients to ensure that they're patient-centered health. The goals are realistic. No one wants goals that are extremely high that we're never ever going to. Okay, so it's interesting because when we work with stop smoking medicine and working with people to stop smoking, actually, it's the rapport that we build and the getting to know them that allows them to open up to us to be able to then move forward with a solution that we can both work on together. And finally, just on that topic, I think we're all quite good communicators. Often I put myself in the realm of, I just work the way that I'd like to be treated when I go somewhere. So, if we're sort of giving everyone the same sort of, treat them all the same with a little bit of respect, asking questions, listening too, and just to double check that they understand what you're saying. I suppose now, I know with a lot of assessment tasks that come in, we see, get a lot of assessment tasks from people who now have English as a second language. And so sometimes I'm sort of finding myself more and more just double checking to understand that they know, that they've heard what I want them to hear. So that's probably a good way and a good start in terms of communicating with Maori and Pacific. I'm just going to show you our website now. So if you look at our website, this is what will come up on the page, www.nts.org.nz. This is where you'll find all the assessment tasks. There's a top bar that says home, what about NTS, NTS Alliance, and then that SSPP portal. So that SSPP portal, there's a drop-down box there, and then you'll be going to the third one down, which is health professionals. So I'm going to click on the main link so that you'll be able to see what I'm seeing. Okay, that's changed here. So that's at nts.org.nz. If you go along that top taskbar and you click SSPP, you will come to the health professionals one. So you'll double click on that, or you'll click on that and that'll open up. Then we'll have the training for health professionals. So on here are the 3 assessment tasks. Task 1, stop smoking medicines. Everything you need to complete that task is there. There's 4 links that you need to look at, and there's your assessment task. On here is the NTS handbook for stop smoking medicines. That handbook is probably a really good thing to open, download, and to print out and have handy, because that has all stop smoking medicines, and it's got everything in depth around it, all the prescribed medicines and the NRT. So everything you need to complete that assessment task is on those 4 links that you'll see at the top. Okay. So to open the assessment task, you just double click on the assessment task. It'll open as a Word document, which you will then open and work on. This website doesn't save it. This will only open the assessment task. So you'll have to save it somewhere else once you've been working on it. So I wanted to just go through the questions in terms of what we're looking for when we look at this stop smoking medicines. So that's pretty straightforward. The first 2, your name, your email address, and when you completed the task. And then we're going to look at so if you just look at the question, you need to provide some brief comments about the characteristics of the 3 different types of stop smoking medicines. So this one we're looking at varenicline. There are only 3 different medicines that they ask you about. There are 8 questions to each one. What type of medicine is this? So, what is the cost to the client for treatment? What does the client need to do to get this treatment? What's the treatment source? See, so with the cost of the client for the treatment, if they've got it on from the GP, and then they're coming to you to redeem it, it would be the $5 co-payment. However, if they were buying it from you across the counter, then you would know how much the treatment would cost there. Okay, so what does the client need to do to get the treatment? Well, they need to maybe go and see the doctor to get a prescription, and then they need to come and redeem the prescription, and then they need to follow the treatment. In terms of the doses, they will ask you the different doses that are needed, so you should be all over that, I would have thought. It will ask you to describe the side effects or the effectiveness of the treatment and the side effects and any other details about that medicine. So those answers are really, then they shouldn't be very long. They can be bullet points. We're not looking for a big essay there, we're just looking for sort of the finer points. But if you were having a look at that Stop Smoking Medicines Handbook, that will have all the information that you need in order to complete that. If we then look at bupropion, which is Zyban, it's the same 8 questions that you'll follow again. And then the last one is a stop smoking medicine of your choice. So whatever you decide to choose, whether it be NRT or anyone on the prescribed list, then you would answer the questions the same for the one that you stop smoking medicine that you choose. So once you've done that, that's part one of the assessment test completed. This is broken up into two parts. Part two is about the different types of support that are available to people. The reason why we ask you this question is just so that if one of your patients decided that they would like more information, then you actually could say to them, well, look, you can ring Quitline, or you can refer them to a stop smoking service for one-on-one support. So the answers to this are, if we have a look back at it's all on the NTS page where we opened it. There is a PowerPoint for pharmacist training. So the information for this area is on the pharmacist PowerPoint training, and I'll show you those slides for what you're looking at. So in terms of the cost of treatment, for example, for this, it's Quitline. Well, the cost of treatment, it's no charge, because people can just ring Quitline. The source of treatment, well, that's Quitline. The number of contacts that people have in their treatment, well, generally it's 4+. So people will either ring or Quitline will ring them, and they have a minimum of 4 contact times, but that can be negotiated with the treatment provider. So actions needed with that treatment, well, if I was a patient, I would have to get on the phone and I would have to ring up. So that's an action. Quitline send out a quit card. I would have to go and take my quit card and redeem it at the pharmacist, at the pharmacy. So that's another action needed with the treatment. The effectiveness of this treatment, it doubles your chances of quitting. Any support, if you're having support to stop smoking, it will double your chances of quitting. If we were looking at the advantages of this treatment, well, it's probably quite good because you can just ring up. You don't have to go in and see anyone. Just get on the phone. They send you a quit card, and then you can go and redeem it. Disadvantage of that treatment is that you need to be able to call them. You might want more personalised service, and so if you want a face-to-face service or you want to come and see somebody, that's a disadvantage because they are only a telephone service. So it's not too difficult. But then you would do the same for one-on-one face-to-face, and then for group support. So, and then that's that assessment task completed. I'll show you the slides that you'll be able to access now to complete part 2. Once you've done that, all you need to do is save that. You've completed the task, and if we look at the summary, you just have to type your name, and then there's an email address for you to send it to at the bottom there. So your last name first, it's task 1, and then you would email it to the email address that's on the bottom. And then once Sue gets it, she will send you a notification that she's got it, and then she will send it to an assessor for marking. I'm just going to show you the... If we just have a look down here, that's assessment task 2 and 3. So it's the same sort of thing. Everything that you need to complete the task is there, and that's the actual assessment itself. Here are the Foundation Hub training videos that you can access whenever you need to. Here is the pharmacist training PowerPoint. So there, if you open that up, it will download a PowerPoint, a PDF, and that will have all the slides that we had on the training. And then also in there will be the answers for the question that you're looking for. So I'm just going to show you, excuse me. Right. Here we go. So this is the three slides you'll be looking for that relate to the different types of support. So that's on a PowerPoint presentation. That's where you'll find it. So if you ever look at individual support, you'll see that it's free, multi-session tailored, supports and meds, at least doubles your chances of putting long-term. And it's got the advantages of it, better rapport, slightly higher quit rates, and then the disadvantages. So if we continue on that PowerPoint, you'll see the one for group support that gives you that information. And then there's one for, there's the quit line is the first one. Then we've got the individual support, and then we've got the group support. So based on those slides, you'll be able to complete that assessment task 1, which is in stop smoking medicines. Does that make sense? Good. In terms of, there was this one other thing I wanted to mention around Career Force. So Career Force are our industry training organisation. And in order to register your NZQA points, you need to be registered with Career Force. So we just did a stock take yesterday and found that out of all the pharmacists that have enrolled, probably about half of them have not enrolled with Career Force. So we'll do a drive and send everything else. Just double checking that you're enrolled with Career Force. In order to do that, you'll need an organisation enrolment. So only one per pharmacy. And then each pharmacist will have to have their own enrolment form. So if you need those forms, we can send them out. And then just to double check, once you've completed your enrolment forms, then if you email them to nts@inspiring.org.nz, Sue, our administrator, she knows those forms inside out. She'll be able to have a look through them, and if there's anything that you need to complete, she'll come back to you. If you send them directly to Career Force and there's a problem, Career Force have about 40,000 students. So sometimes the paperwork gets lost and then we don't find it. They don't find it for between 3 to 6 months, which is why we ask you to send it to Sue so she can keep an eye on it. So if you have any problems with that, let us know and we'll be able to help you with that. Okay. So that's it from me. Grant, would you like to take over now?
Yes, I would. Thank you, Edward. Do you want to ask if there's any questions about what you've just discussed?
Yes, I can take questions.
If there's none, then that's fine. Does anybody have any questions for Edward? No? Okay, we'll move along. So for those of you who have come on later, my name is Grant. I work with Edward at Inspiring Limited, and we work together on the Stop Smoking Practitioners program. So I'm going to just share the process for doing the assessment task where you need to describe what you do with a real client. And in the version that you, the pharmacists in Auckland, need to do, there's the component is for 2 people. So you need to work with 2 different clients, one who is of a culture different from your own. So for me, I'm Australian, so I could work with a Maori person or a Pacific Island person or a person from China or India, and that would be fine because of the cultural differences. In Waitemata, there was a quit coach who works with the Asian specific services, and she worked with, she was Chinese, and in order to do this particular assessment, to work with a client from a different culture, she worked with a Japanese man to help him stop smoking, and so on and so on. So that's one of the tasks, working with a client who's from a different culture than your own. The second task is working with a client with complex needs. So that can be pregnancy, it can be morbid obesity, it can be diabetes, it can be issues such as heart disease or smoking-related disease or addictions to other substances. So there's two real clients that you need to work with to help them stop smoking and describe what you do with those people. The reason you have to do this is because the Stop Smoking Practitioners program is unit standard based, so it all fits on the New Zealand Qualification Authority framework, and the unit standards are very specific. So they tell us what the questions in the assessment tasks must be about in order for those completing the assessment tasks to meet the requirements of the unit standard. So we don't have any choice about that. We have to ask questions that NZQA says this is what is needed for adequate practice for someone who is offering stop smoking support over multi-sessions. So that's why when you open these assessment tasks up, they sometimes look like, wow, that's a lot of work, and I don't have the time to do that. But it's because it is based on the national NZQA framework, and we have to do it this way to meet the learning outcomes that are embedded in the unit standards. So having said that, I'll share my screen and I will open one of the assignments. I've got everything showing but my desktop. And I don't know why that is. No, I'm not getting my desktop, Edward.
If you click your share screen.
Oh, here we go.
Yeah, there we go.
Yeah, sorry.
What are you actually looking for?
I'm looking for my desktop. No, I'm sorry. I can't. All I'm seeing is Zoom.
Okay, so you should be able to just pressing your share.
Sorry, what was that?
You push your share.
I can't hear you.
Do you want me to open one up for you?
Yes, please. Can you open task 2?
Sure.
Oh, here we go. I'm on.
You're on? Okay.
Oh my God. What's happened there?
No idea.
Very creative, Grant.
I don't think that's me.
Are you?
Hang on. Okay. I think I'll share again and see how I go. Yeah. So it's good now. Here we go. Sorry about that.
These are your daughters.
Yeah, that's my daughters. That was when they were in Bhutan in Asia.
Wonderful.
Obviously, they got their mother's good looks.
That's just impolite and a little bit rude, Edward.
Their father's intelligence, I'm sure.
Yes. Thank you, Denise. Okay, so when you're doing the assessment tasks, you're going to need to work with a client over a couple of weeks to help them to stop smoking. So for the purpose of this assessment task, they don't have to be successful at that. They can try as hard as they possibly can and then relapse, or they might go on to become smoke-free with your support. So that it's not about testing you as a quit coach. It's about you describing what you did and said and prescribed in terms of medicine and advised people to better support them to stop smoking. So we're looking for evidence about how you talk to people and what you say about stopping smoking. So that's all we're looking for. The other thing is that this is a level 3 qualification. So all of you will have done your degree, your pharmacy degree, and which I think in New Zealand is at level 7. So unfortunately, we're dropping you back a little bit to cover this because of the requirements of your DHB contracts. So it's not at level 7. We're not looking for that sort of in-depth analysis, in-depth writing that you would have done through your degree program. What we're looking for is how you work with people specifically over time to help them, to give them the best chance to stop smoking. So this assessment task is evidence for your Maori client. It's preferable that if you work with a Maori client, of course that's not possible for everyone, so hence why we say, or a client from a culture different from your own. The information here is asking for descriptions about your first meeting with your client, and you would have been supplied patient records from the DHB about how many cigarettes the client smoked a day, what time to first cigarette after waking, other health issues, other medications, so client case notes. Some pharmacists have been calling us and saying, it's really hard for us to do that because mostly we just see a client for a little while, half an hour or so, and we talk to them about the stop smoking medicines, and then they go off. So if you can't work with a client week by week by week by week to help them stop smoking, then it's going to be a little bit difficult for you to do this, because the aim of this contract was for you to see people and support them over multi-sessions to help them stop smoking. So maybe, is that going to be an issue for you out there, you think, knowing this now? Or should we just plug on? Yep, we'll just move on.
Maybe I could just say, Grant, you're explaining this all very well, and thank you. Obviously, working in a busy pharmacy, they will have concerns about the time that they can spend at any one time, and some pharmacists might actually just do the first intervention very quickly, but then say, could I phone you back to finish this off? You know, it's just one of those situations where they have these limitations.
Yeah.
But they can still be in contact as regularly as the patient would want. Yeah.
Via the telephone?
Yes, via the telephone as well.
Okay, that's absolutely fine, because as you all know, the Quit line does exactly that, and the stop smoking practitioners who work for the Quit line, they all do this assessment task. So when you go through the questions, now it'll tell you all of these things you need. Really what we're looking for is, this is quite precise because it's based on the unit standards that we have to adhere to. So the unit standards, they want you to talk about setting a quit date, what you said about coping strategies, what stop smoking medicines you recommended, and so on and so on and so on, taking progress notes, all of which is potentially not viable in a pharmacy setting. So what we're looking for is the real basic support and case notes that you took with each person you worked with about their smoking rates, how many they were smoking a day, what their dependency on nicotine, how you gauged that. So anything that you have, send that to us to support it, and we understand as assessors that you're in a pharmacy situation, and we take that into consideration when we mark it. So you're not spending 2 hours every week for 8 weeks with the same person building up this portfolio of information that stop smoking practitioners in face-to-face services in the community are able to do. So,
thank you. Right, that's very well said. Thank you.
Okay, yeah. So long as all we're looking for is evidence that if the client is smoking 20 a day and the client has his or her first cigarette within an hour of waking, that you're not prescribing 1 milligram lozenges to help them stop smoking. So at that sort of smoking rate, you'd be looking at 21 milligram patches, Champix or Zyban, and plus if it was 21 milligram patches, you would probably be recommending either 2 milligram lozenges or 4 milligram gum at that smoking rate. So that's what we're looking for, that you actually know how to measure dependency and then prescribe and support the use of the stop smoking medicines to give the person the best possible chance of stopping smoking, to make sure you've met the standard. So here are some of the questions. And again, as Edward was saying in the last one, it can be just bullet points about what you did. So it'll talk about referring, and if they just walked in up the street, there was no referral, it was a self-referral. Oh, sorry, I'm looking at something different. We'll come back to that in a minute. So there's your information, so we know who's sending this. It's coming from you, and we can respond to your email address. So here's the referral information. I was getting a bit of ahead of myself there. So they walked in off the street into my pharmacy, and they were interested in stopping smoking, so they became one of my patients. That's the answer. So as you talk to the client about their smoking history, what triggers smoking for this client? So after talking to them about the reasons they smoke and why they want to quit, you might find that they have highly stressful lives. They've got lots of kids at home who are always demanding, and the only time they get to spend by themselves is when they go out the back and stand there and have a cigarette. So they're the cues that trigger smoking, and so on and so on. So past relapses could have been a death in the family, a traumatic event. It could have been they went out and got drunk and had that one day, freckless cigarette, and then went straight back to smoking. So this is all the information you will gather from people when you're supporting them to quit smoking. So it's all about what you did, how you did it, why you did it, and how the client reacted to that, and how they and how you monitored the client to make sure that they were sticking to the plan that they agreed to, and that they were using the stop smoking medicines properly, regularly, and that they were changing their behaviours with your support to help them stop smoking. So there are a lot of questions, but this is the information that the unit standards demand. So again, it's just bullet points in here. So how does smoking on the client's social life or social circle, and how will quitting change this? So you might know, for instance, that no one else in the client's social circle smokes, and all the kids want that client to stop smoking. The question is, they all want my client to stop smoking, so therefore they won't be exposed to secondhand smoke. Often it's about money, the reasons why people want to quit smoking. So pretty much that's all I think we need to go through from my point. And if you do get to well, here's what Edward was touching on. How do you respect the client's cultural needs for partnership, participation and protection? So that applies to anybody. So partnership, you can't come over as the expert. You can't tell them, this is what you need to do. I'm going to put you on Champix because that's the only thing you haven't tried yet, and you need to stop smoking because you've got XXX wrong with you. That's not a partnership, that's a dictatorship. So how do you respect the client's need for partnership? Participation. How are you going to get the client to suggest what will work for them? So what are you going to do when you get home, when you wake up in the morning? Say, what are you going to do when you wake up in the morning? And that's the time you always have your first cigarette out on the deck with your cup of coffee. Give me some ideas what you could do differently. That's working in partnership and participation. They're participating in their own care. And protection. How are you going to protect their sense of well-being? How are you going to protect their need to stop smoking when their lives may be very complex? All of those things. And you can just briefly describe those in sections such as this. And some of the information that you list, the information and advice that you gave. So it could be here, the client had used NRT in the past, but hated the taste. So what advice did you give? The advice I gave was, well, there are patches. They have no taste. You adhere them to your skin, and so on and so on and so on. So you can see that it's really commonsensical, and it is at level 3. So long as you're not writing your answers that you haven't checked any of the reference manuals. So you're prescribing Champix, say, for instance, that you were telling pregnant women that they could use Champix. We're probably going to pull you up on that. So if it's factually correct and you've done your research and what you're advising your patients to do and how to use stop smoking medicines in order for to give them the best chances to quit, we will be able to assess it as achieved. So, Edward, I think I'm pretty much done there.
Well, maybe if you'd like to unshare your screen.
Okay.
And that way then, do we have any questions from anyone? Would you like to make any comments, Denise?
I thought that Grant explained it all very well, and the fact that NTS will be cognizant of the different situations that pharmacists are working within, and that it is very hard to give a patient full attention for 45 minutes to an hour, which is what the full-time practitioners do. So what information that is absolutely necessary, if that can be given in such a way that you can explain what worked, what didn't work, etc., and how you communicated, I think is really important. And you all have the forms which are very simplified, the initial consultation forms and the follow-up consultation forms, which hopefully you'll be well aware of now. They, of course, contain a lot less information than the forms that you'll be filling in to do the assessments. However, I think MTS will take this into consideration, provided you have given the information that they feel is necessary. Does that put it?
Yeah, no, that's good. So I was assessing a pharmacist's complex needs assessment task just today, and she was working with a client who they knew quite well because she was on the methadone program. And so she would be a constant visitor to the pharmacy. And so she was able to work with her every time she came into the pharmacy week after week after week. And the care was fantastic. And the case notes for that patient weren't as in-depth as what a community full-time quit coach would do. But they were more than adequate for the purposes of this particular assessment task. And all her advice and all her support for that woman with these complex needs easily met the standard required to achieve this assessment task and have it done. So there's a couple of questions I'm just looking at really quickly about the verification. So the verification on the assessment tasks that you come across, it's really about someone within your organisation who has seen you work with someone to help them stop smoking, and can put their hand on their heart and say, yes, that person, or say, Edward does all of the things listed on here. I can put my hand on my heart and verify that he does all of these things. He is caring and he is culturally appropriate at all times. And because we can't know that someone has sat with you with all your clients as you were doing this for the first time, of course, and that's actually occurred. So that's what we're looking for, that someone can put their hand on their heart and say, you do all the things well that you have said that you do in this assessment tasks, and that's adequate in terms of that.
I guess also too, another way of getting your verification is to just, with your patient's permission, do a voice recording. With the voice recording, you are then able to submit that. The assessor will be able to hear exactly how you discussed and how you talked to your patient. So if you can't get anyone to verify you, then that's another way of gaining verification. You just submit a voice recording of your consultation with your patient, and that will be sufficient.
Right. As long as you get the patient's
Permission.
Yeah. So generally, I would with patients and clients, if you explain what you're doing, more often than not, they're very happy to help and be part of it. You just have to sort of maybe not use their name, so just to keep all their personal details outside of the conversation, just so that any identifying factors, we can just ensure that their name and identity is kept anonymous.
Yeah. And the other thing I'd like to say is that another pharmacist from the North Shore rang today, and he was concerned because he had worked for 2 sessions with someone wanting to stop smoking, and then the client was lost to service. So he'd done 2 sessions and then couldn't contact her any other way, and he was using that client for the purposes of this case study or this assessment task. So what we can do in situations like that is that you've met the client, you've talked to the client about history, dependency, and all of those things, and you can actually write these assessment tasks in terms of what you would have done to help that client stop smoking if the client had have continued coming to the pharmacy to get ongoing support. So that also is fine. So, and the good thing about that pharmacist ringing today was that that's our role. We're here to support you to get through the assessment tasks. So if you have any questions at all about anything that you find in these assessment tasks, all you need to do is contact either myself or Edward, and we will be more than happy to guide you through the problem areas that you may be having.
Well, it's awesome to know about your flexibility. So thank you very much for that. And I think, as you've alluded to, the pharmacists are doing a level 7, and they've been, very highly involved in highly complex tasks. But I think when it comes to human contact in practice, it can seem a lot more daunting. So even though it's a level 3, that because of the rights of the person that you're dealing with and the privacy concerns. So I think this possibly has been a little bit of a barrier for some people, even though it's not nearly the complex task that they're used to. It involves a human being, and that can make it.
And it's also people are scared about stopping smoking. They're frightened that you're going to take away their coping mechanism, their friend that's been with them for sometimes 30 years, and all of a sudden you're going to give them medicines that are going to take their coping mechanism away, and they're scared and worried, and often they won't like you for it. And so it does get human very, very fast.
Absolutely.
Yeah.
Absolutely. Yes.
And I guess, Denise, the good thing about this is actually you only need to do it once in terms of gaining the qualification that you need to gain. So whilst it might seem a lot of work initially for those 2 assessment tasks, when you actually go through it, a lot of the questions are just yes or no questions. Just remember, is once you've done it once and you've got your credits, you're done. No one comes to revisit that in terms of, how you might work with people in the future. But in terms of the broad learning that you'll get from doing the assessment tasks 2 and 3, they will always remain useful in your practice moving forward.
Yes, indeed. I see Aaron's put on a question about vaping devices. who does the answer to that? Can any of us do the answer to that? Or because Erin is one of our pharmacists who's been quite proactive and now stocks Quitstick. Is that right?
Yeah, so absolutely. So if somebody comes in and they've tried all the other stop smoking medicines and they are interested in vaping devices, you're more than able to have a talk to them about the vaping devices. Absolutely. The only thing we find is that a lot of people with their information and their knowledge around vaping devices is many and varied. But if you're now stocking the vape devices and they would like to use that as an option for cessation, you're absolutely able to then present them with the information around the vaping device.
Mm-hmm. Good. And Erin, you know where to get that information from?
Just the thing is, I'll be doing the consultation and everything the same way, but because they're not getting the NRT products, pharmacy won't be getting funding on this.
Well, that's
helping them to quit smoking.
Right. So, but they don't need to use the stop smoking. If they're coming to you and you're supporting them through the stop, for them to stop smoking, and you're choosing a vaping device as a cessation option, then you should be eligible because you've actually supported that person to stop smoking.
Okay, so I can still enroll them into the program.
Absolutely, still enroll them into the program because you will still be supporting them, regardless of what option they choose for their cessation option, whether it be stop smoking medicine, a vaping device, which is also a cessation tool. You're still getting advice and the support, which motivates them and leads them to their stop, their quit.
And that would extend to a doctor, somebody coming in with a script for Champix or Zyban, that you can still just support them, or somebody who's not using anything to help them stop smoking. So the medication or the assistance that they're getting from vaping or whatever is incidental to the process.
Okay, so as long as I'm documenting the consultations and support, that is sufficient enough for the
and that should be documented. Actually, they've tried this, they're not interested in that. They asked about vaping devices, we discussed that, and we put them on a vaping device as a cessation treatment.
Yep. It's fine. Good.
Do we have any other questions? Must be dinner time nearly then. Thank you, everyone. So what I'll do is I'll look at editing this evening, and then it will go up on the NTS website tomorrow. I will send you a link that needs to distribute to everybody so that people will then be able to look at this via our YouTube channel at their leisure. And there we'll also put our contact details in terms of being able to get hold of me and Grant so that you've got access to us if you have any questions whatsoever or any support as you're going through your assessment card. Our job is to get you through and to help you through and assist you at every step of the way.
Sounds great. Thank you very much. And great to be able to watch you, Erin and Lynn, during the process. Couldn't see anybody else, but never mind. It was nice to see you guys. All right.
Well, good night, everybody. Have a lovely evening. Thank you for your time tonight, and we'll catch you on here again soon.
Thank you very much.
Okay.
Good night.
Goodbye.
Good night. Bye.